Hi, I'm Dr. Jackie Kirihara, a naturopathic physician.
And I'm Ashley Koch. I'm one of the functional medicine nutritionists here at BioLounge. We're so glad you joined us for our Teen Health Talk. We're going to be talking about evidence-based tools for addressing acne, digestion, and hormone health. So here's what you can expect from our talk. We're going to review the hormones involved in puberty. We're going to discuss the sequence of development that happens in puberty and the changes in males and females. We're going to talk about what you can expect in an adolescent that is cycling versus what you can expect from an adult. We're going to talk about abnormal menstrual symptoms, so you can identify these in your daughter. And we're going to review nutrition skills that can improve the menstrual and hormone life for males and females. We're going to address adequate hydration and discuss the importance of avoiding and eliminating toxins. From there, we'll review the action steps that you can take as parents to support your children in this phase of life. And then we're going to talk about when is it time to ask for help from a provider.
So when we're talking about puberty, we really need to get down to the nitty-gritty of what's all involved in this hormonal cascade. So it actually all starts in the brain, in a particular region called the hypothalamus. In this region, the hypothalamus begins to secrete gonadotropin-releasing hormone, or GnRH, in a pulsatile method. This method actually creates a lot of the buildup for the physiological changes and the physical changes that you can actually see during the pubertal time. This GnRH goes on to stimulate the anterior pituitary, another part of the brain, to secrete two hormones, LH and FSH. Now, both of these hormones act in very important ways during the pubertal time for males and females. For example, in adolescent boys, we find that LH actually begins the testosterone production from specific cells of the testes, and FSH also interacts with a different category of cells in the testes along with the testosterone to produce sperm. For females, we're looking at LH actually stimulating specific cells of the ovaries, the thecal cells, to produce progesterone, while FSH stimulates the granulosa cells of the ovaries to secrete estrogen. Now, oftentimes we don't talk about male hormones and male boy pubertal development because we don't have this big event of the menstrual cycle happening. And so it's really important that we go over the expected development of males during this time. It all begins with testicular enlargement. And this is because of that LH and FSH stimulation of testosterone and sperm production. And this is because all of those different things that are needed for these things to be produced actually increase in size in order to produce the sperm and the testosterone needed. Then after that stage, we could see penile size and pubic hair growth, which is stimulated by that testosterone release. Testosterone in itself is the main driving factor of those physical changes for boys. Then we will see the first ejaculation and voice and height changes. Now, this specific time during the pubertal development is actually stimulated by a combination of estradiol and testosterone that's released in males. And this interacts with another hormone called growth factor, an insulin-like growth factor that makes trabecular changes in bones, as well as the vocal cords of boys. And then lastly, we see facial and axillary hair growth, and this is obvious. This is driven by testosterone. The time frame that we're looking at is ranging between 10 and 14. Sometimes we can see some of these initial changes start around 9 and go all the way until 16. Like I said earlier, there are many misconceptions about boys' health during this time. When we're talking about girls going through puberty, we're addressing this huge shift in developing a menstrual cycle, whereas boys, it kind of goes under the weather. So there's a common misconception that males have less health needs or concerns during this time. This is very much not the case. This is a crucial time for you to encourage your son to start engaging with a healthcare practitioner regarding many different shifts during this time, whether it is mental health concerns, whether it's physical changes, or any questions or concerns around risk behavior. There's also a misconception that fertility is achieved at first ejaculation. This is just not true. It's actually 6 months to a year after the first ejaculation. A lot of that spermatogenesis is just starting to occur and happen. And so there really isn't that concern of fertility right off of the bat. Like I said earlier, the other health concerns that are important to address include sexual health, risk behaviors, substance abuse, and mental health. Now, probably something that we're all more familiar with is the female pubertal development. The first signs of the female pubertal development start with breast bud development. And this is due to that increase in estrogen and progesterone, which actually causes breast duct and alveoli to develop. So the actual structures within the breast tissue are developing under that hormonal control. Then oftentimes we see about 6 months after that breast bud development, pubic and axillary hair growth, and this is mediated by testosterone. Then we see we begin to see that the increase in that FSH and LH due to that increase in pulsatile secretion of GnRH to cause then the first menstrual period. And the first ovulation actually happens about 6 to 9 months after that first menses. And then the last thing that we're often seeing with girls is a fat redistribution, bone maturation, and continued breast growth. And this is driven by a specific form of estrogen, which is estradiol. When we're talking about the adolescent menstrual cycle, we need to make sure that we're looking at it from a different reference frame than an adult menstrual cycle. And this is often not really talked about. And so we first need to know, when is it supposed to first happen? So in a well-nourished individual, the average age is between 12 and 13 years old. It can actually take up to 3 years for your daughter to establish their normal cycle. And cycles during that first 3 years can be 21 to 25 days long. And this is important because we're usually looking for a normal cycle to be around 28 to 32 days. So there isn't a concern around the 45 within that 2 to 3 year period when you're experiencing this more immature pattern happening when they're trying to regulate. And also that menstrual bleeding can last up to 7 days. Now, this is probably one of the most important signs is, what is abnormal? What are we trying to look out for in our adolescent daughter for something that's abnormal? This includes things like menstrual bleeding that is for more than 7 days. If their bleeding is heavier than needing to change a pad every 1 to 2 hours. If the cycle length is longer than 45 days or shorter than 21 days. If there isn't a cycle by the age of 15 or 3 years after breast bud development. Also, which is often normalized, are premenstrual symptoms, fatigue, acne, headaches, severe mood swings. All of these things I hear women talking about regularly and normalizing, which actually they're all signs of an imbalance. Also, spotting in between menses is a sign for concern, abnormal vaginal discharge or odor, as well as hair growth on the chin, chest, or abdomen. So how can you support your adolescent? So the first is by really focusing on decreasing any inflammation regarding hypothalamic and pituitary gland function, which again are parts of your brain. And there are studies that have shown that high blood sugar levels as well as high fat diets can actually increase inflammation, specifically in the hypothalamus and the pituitary gland. The second major component of this is eliminating environmental endocrine disruptors. And these can be anything from their exposures to certain plastics, to heavy metals, to also all of our environmental factors, particularly around phthalates and things that are unfortunately often in our air. The other way that we can support our adolescent is through enhancing our child's diet with nutrients that target hypothalamic, pituitary, and gonad health and function. And now that goes into some nutrition support.
Yeah, so talking about the relationship between nutrition and hormones, nutrition impacts hormones and hormones impact food and fluid intake. And so there's really a bidirectional relationship we have to think about. And so our goal is to really maintain the balance and be able to respond to the environment around us. And that's important. And because that's where hormone production and secretion comes into play. It's helping us maintain that homeostasis and stay in balance at all times. And it's a very tightly controlled system. Also, in order to have adequate hormone production, we must have functioning organ systems. And that's really coming back to that HPGA axis that we were talking about, which is really responsible for controlling the hormone homeostasis and managing our hormones. And so we have to be thinking about how are we protecting that organ system and the things Dr. Jackie was just talking about. So what does that really mean? When I heard Dr. Jackie talking, she was mentioning it starts in the brain, and then she mentioned some of the other parts of the body, like the ovaries and the testes. And really, what are those things made up of? They're all made up of cells. And so in order to have healthy hormones, we have to have healthy cells. You can't have a healthy organism without healthy organ systems. You can't have a healthy organ system without healthy organs. And you can't have healthy organs without healthy tissue. You can't have healthy tissue without healthy cells. So really, we need to be protecting the health of our cells on every level to really protect the steps that it takes to have healthy hormones. So healthy cells or healthy bodies need three things to be successful. One is that they need adequate nutrition that provides energy. Cells can't do their jobs without energy. And so where do we get that energy? It's often through diet. And then they also need the ability to get rid of toxins, which often we're excreting toxins from the body through urine, sweat, and stool. And so our cells need to be able to get rid of toxins, and our bodies need to be able to get rid of toxins to function adequately. And then they need a proper environment, which can look like a lot of different things. So healthy cells need a proper environment, healthy bodies need a proper environment. That can mean a lot of things to different people. It can be healthy relationships, access to healthy, clean air, access to clean water, access to adequate nutrition. There's a lot of factors that go into protecting the environment of the body. And I'm going to walk you through some of this in more detail. So what is adequate nutrition? So essentially, I think about nutrition as the process of taking in food and fluids and using them for metabolism and repair and growth. Metabolism essentially is the millions of chemical processes happening in the body every minute. And repair is all the things that your body's going to clean up. So as Dr. Jackie mentioned, we know some lifestyle factors that lead to inflammation. If we have inflammation, now your body has to be in the state of repair, cleaning up what's happening so that it can do what it needs to do. So here I'm going to highlight for you some of the things that we know help get adequate nutrition and protect our hormones. First, we need a diet rich in a variety of plants, and these are going to deliver a range of polyphenols to our microbiome and the bacteria that's really protecting our health. We also need access to adequate protein, quality fat, and the right carbohydrates. And so not all foods are equal. So really thinking about how we access these foods. We need to have adequate water as well as electrolyte intake, especially for our teen athletes who are out there sweating on a regular basis. It's not just about rehydrating with water, but we got to bring with that electrolytes, which are going to make sure the water gets in and out of the cells so that our body can do our job. And so we have to make sure sometimes we're replacing the electrolytes they're losing. And I'm not necessarily talking about electrolytes that come with those big sugary drinks. There's a lot of other ways to get electrolytes into our teens. We need anti-inflammatory foods. So inflammation makes this whole process much harder. So we need to make sure we're focused on anti-inflammatory foods and our children have access to them in their homes. And we need blood sugar balance, as Dr. Jackie mentioned. So if our children are experiencing blood sugar spikes all day, it's really hard to have healthy hormones. So really, we have to teach them how to eat in a way that they're not having those blood sugar spikes on a regular basis. Other foods that are important, probiotic foods can be really powerful. They're going to feed the microbiome and protect the bacteria that really have a relationship and are producing hormones, which include foods like kimchi and sauerkraut. And then prebiotic foods are really powerful. So that's your sunchokes, asparagus, bananas. These prebiotic foods are going to feed the bacteria in our colon, which are going to kick out metabolites that are really important to repairing our digestive system and protecting our hormone health. We need to make sure we have nutrient-rich, mineral-rich foods. So not all food is the same any longer. So knowing that you are getting access to food that's growing in healthy soil will impact how much nutrients is in the actual food you're eating, and making sure you're getting all the nutrients that your body needs to be successful. We also need insoluble and soluble fiber. So thinking about insoluble fiber, it's coming from the vegetables you're eating, or soluble fiber might be coming from things like beans and lentils, as well as we have hemp, chia, and flax. But making sure you have a range of this. Most Americans are not getting enough fiber in their day. And so this is really low-hanging fruit. How do you increase the fiber intake? As well as we know that some of the hormones need to get out of our body. So things like estrogen can be really anti-inflammatory. They're important for the process, but then they become toxic and they need to head through the liver and get out through our stool. And so having fiber on board to really help get those excess hormones out of the body is important. We also need to have foods that are free of additional toxins. So if we need to be able to eliminate toxins, we also want to limit how many toxins we're being exposed to. And so that means eating foods that are organic, free of pesticides, non-GMO, grass-fed, free of added hormones. So what is proper absorption and digestion? If you spend all this time helping your child build a healthy relationship with food, which is something Dr. Jackie and I can partner with you on if you ever need additional support, because as parents, we know it's not easy, but it's worth the effort. And so once you're getting that adequate diet in, is your child actually digesting and absorbing the nutrients they're eating? So here are some of the things you can look for that give you a sense that that's happening. One is, are they having regular daily bowel movements? So what does a regular bowel movement look like? Often we tell clients that they look like snakes, or they look like the shape of the colon. They should be well formed. And so if there's a period of constipation or diarrhea, then we have some concern around digestion and absorption. Another thing we're thinking about is, do they have proper motility? So how long does it take the food to move from the mouth and come out in the stool? That tells us about motility. We have creative ways of really testing that in clinic and getting a sense. But if food's in the digestive tract for too long, then we know we're just reabsorbing toxins and it's going to create problems. And then if food's in the digestive tract for too little amount of time, then we're not absorbing the nutrients we need from those foods. We also need proper digestion that has a healthy microbiome. And so that's work we do a lot here at Bio Lounge, is building healthy microbiomes or repairing the microbiome, which is really the bacteria, the yeast, and the many things that live in the digestive tract. We now know that there is this great microbiome in estrobolome, which is essentially the bacteria that has a relationship with our production of hormones that live within the digestive tract. And so if we're not protecting our microbiome, we're not going to be able to protect our hormone life. We also know you have proper absorption and digestion if you're free of digestive symptoms. So if your teen is suffering from things like stomach pain, bloating, excessive gas, belching, foul-smelling gas, diarrhea, or constipation, those are all signs that things are not happening as they're supposed to be, and that your teen needs additional help. So how do you protect the microbiome? We said that it was important to have a diverse microbiome. So what do you do? So the microbiome essentially is trillions of organisms and bacteria, fungi, sometimes parasites and viruses found in the small and large intestines, as well as on the surfaces of the body. And the estrobolome really refers to the collection of bacteria in the gut, which are capable of metabolizing and modulating estrogen. So really the microbiome and the hormones have a strong relationship. And so really learning ways to protect your microbiome is going to end up protecting your long-term health and your long-term hormone health. Symptoms. So what are symptoms? Symptoms are signals from our body. So we have to notice our symptoms. And if we have persistent symptoms, those are our body's way of communicating what it needs. And so really teaching your teen that that's what's happening with those symptoms. Okay, it's your body telling you we have to pay attention. We need to do something differently. And even if our children don't listen to us at all these times, just building that connection and understanding. They might not be listening now, but they might listen later, because sometimes symptoms get louder. And then when they do, your teen will remember that you've built that connection to what's happening in your body. Toxins. So we said the body needs the ability to get rid of toxins in order to support hormones. We also call this detoxification. And so really protecting healthy detoxification is going to protect hormone health. And so you need to do this by making sure your teen is sweating regularly, exercising and moving their bodies. And if they're not sweating regularly, getting creative of how you can sweat, because we excrete a lot of toxins through our sweat. And we also talked about healthy bowel movements. So if they're not having healthy bowel movements, then we know they have detoxification issues. So really focusing on how you can improve their bowel movements. And then urine, they need to be drinking lots of water and having and urinating regularly. And you can tell if it's healthy by looking and seeing if it's clear, for the types of colors you're seeing in the toilet, get a sense of whether they are getting toxins out of their body. But there's a lot of other things we do here at Bio Lounge to really support healthy detoxification. One of those things is we are passionate about supporting the liver. And while I don't expect you to remember or understand everything we're seeing here, this is essentially the work of the liver. It goes through phase 1 and phase 2 detoxification. And what I really want to highlight for you is there's a lot of nutrients required to be successful at this. And why is it important? So the liver's job is to take toxins out of our body. And so if we support our liver, it can do that. And so, for example, here you see in green, the nutrients used in phase 1 detoxification in the liver. So you need B2, B3, B6, folic acid, B12, you need glutathione, which is our master antioxidant, and you need amino acids to be successful in the liver in this phase. And then if you look through phase 2, there's a ton of nutrients required to be successful here. And then we also need antioxidants. So when things are becoming less toxic through the liver, first they become more toxic. We need antioxidants, which we get from food, to clean up the mess that's being created and protect us from that before they go through phase 2, and then they leave our body through our urine or our stool. And so essentially what I wanted you to understand from that is that we need a lot of nutrients to be successful at this. And so if we're not getting that through diet, then we need to start thinking about supplementation with our teens until we can improve their diet. So how do you support proper detoxification? First, it's through nutrition. Then it's through making sure they're having adequate and regular bowel movements. Are they regularly sweating? Are they drinking plenty of water and accessing electrolytes? And then are we limiting their exposure and lowering the toxic burden on their bodies? So what is adequate hydration? One, it's drinking plenty of water, which varies based on how old your child is and how much they weigh, but making sure they have access to water throughout the day and that they're drinking it. And then also it's considering electrolyte support, which is especially vital for teens that are sweating on a regular basis. And so what are some ways you can get electrolytes in your teen? First, it's something like Himalayan sea salt can be filled with some of the trace minerals that are really important. So you can use that generously on your food, or you can also sprinkle some of that in water and drink a glass of water. Or you can try products like Noon. I would definitely, if you're trying something like Noon, make sure you're getting the caffeine-free version and making sure you don't have something that has added sugar. But you can put that in a glass of water instead of having something like those sugary sports drinks and replace electrolytes they might have lost through sweating. It's also really important during the summer when they're out in this, and these hot temperatures. Some of our kids are out in 100-degree weather running around. Make sure they get their electrolytes. Or we use things at Bio Lounge like trace mineral capsules or drops to replace electrolytes. When do you take them? You could take them before a workout or after a workout. All will improve the outcomes. So what are some ways you can reduce the toxic burden on your child? So avoiding toxins when possible is really powerful. So we have to think about things like heavy metal, which, for example, could be lead. So we could be getting these in various ways, depending on the food we're eating, the water we're drinking, trying to avoid mycotoxins, which can make our hormone life really challenging. So if you know that your child's being exposed to mold, thinking about how you address that in your home, if you have the option, and mitigating and water damage before it becomes mold. We can also limit our exposures by avoiding things like BPA, BPS, and plastics. So if you're BPA free, that's great, but when you buy plastic, they're still putting BP something in there. So it could be BPS or BPN, and it's all just as toxic. And those are examples of those endocrine disruptors that Dr. Jackie talked us through that are going to make things challenging. We also have to think about parabens and beauty products. So if we're thinking about what we're putting in our body, then it's just as important to think about what we're putting on our body. So helping our teens access things like clean beauty or products with very limited ingredients so that we can protect their hormone life. Limiting exposures to pesticides is really important. PCBs, PFOAs, or aluminum in cookware. So our cookware can be incredibly toxic. So if we have the opportunity and we need to replace cookware, trying to replace it with things that are healthier. And avoiding flame retardants in furniture can be really important and lower our toxic burden. So acne. So inadequate digestion and hormone dysfunction lead to outcomes like acne. So acne is not something that has to exist for our teens. If we want to improve acne, then we have to understand that it is a symptom that they have inadequate digestion and they're having hormone dysfunction. Our skin is one of our largest organs for detoxification in the human body. So it's really a window into our internal life. So if you're seeing a lot of acne, that tells you that your child has dysregulation in the body, and it's a symptom telling you to pay attention, and that something's congested in the detox pathway for your child. So environment. So that last piece, you need a proper environment. Adequate hormone creation and management requires a proper environment. And environment can mean so many things to your teen, and really figuring out what that means to them and what supports they need. It could be a sense of purpose and perspective or an attitude. It could also be a sense of belonging, feeling safe, feeling loved, and feeling seen. It can be about addressing stressors in your teen's life, could be a part of creating a proper environment. It can be a safe place to sleep, clean water, clean air, adequate nutrition and hydration, or free from inflammation and chronic infection. So really, how do we cultivate a proper environment for our teens, help them understand the choices they make about their environment impacts their hormones and their health? This could even be, who are they spending time with? Do they have positive relationships in their life? So thinking about all that and helping them build connections to this and feeling empowered. This is not happening to them. They have the ability to impact what happens from here. So what can parents do? First, they can emphasize the importance of listening to your body. So your body's sending you a message all the time. We have to listen. And all bodies are unique. What's happening inside of my body is different than what's happening inside of yours. We can encourage curiosity around the complexity and the intelligence of the body. We can teach them that symptoms are signals that something needs to be addressed. We can establish foundation of quality anti-inflammatory whole foods and proper hydration. We can consider how to eliminate toxic exposures in their daily life and educate them on the choices they're making and what comes with them. We can create a healthy environment, and then we can address deficiencies. So you might work really hard to address your child's diet, but sometimes it's going to miss the mark. And so that's where supplementation or working with a provider who has that skill can really help address deficiencies. So if you get your child eating really well, but they're still having lots of symptoms, then ask for help. And then we can support them in accessing knowledge and information that allows them to feel in control of their health. Dr. Jackie and I often see parents of teens, but we also see teens, and it's great to involve them in the conversation and help educate them and help them understand that they're in control.
So when should you seek care for your adolescent child? And this goes back to those abnormal symptoms. Are they experiencing, severe PMS? Is there irregularities around their cycles as far as how much they're bleeding? For how long are they bleeding? Is your son maybe disconnecting from their typical crowd? Are they skipping school? I mean, all of these reasons for boys and girls in this adolescent time period are really great opportunities for not only you to connect with your child in taking over their health and controlling their bodies, but also for them to build a relationship with a practitioner. And that's really important. There's also ways that you can provide specific support in applying the nutrition and lifestyle tools that Ashley has reviewed today. And then also looking for lack of significant improvement in symptoms with applying the nutrition and lifestyle tools at home. A desire to avoid pharmaceutical management or seeing undesirable effects from pharmaceutical treatment. A lot of times, the typical approach to a lot of the symptoms that may arise during this time are either covering up or disrupting this natural hormonal cascade that we really need to work on nurturing instead of putting a band-aid over top and preventing for long-term health outcomes. So at BioLounge, Ashley and I work together to utilize specific testing and appropriately evaluate an abnormal symptom pattern. We assess for the use of herbal, amino acid, mineral, and other supplemental therapies to really nurture that entire cascade of hormones in order to build that really good foundation for your child and to reestablish balance within that feedback system and axes. So we really thank you for joining us at our webinar, and we hope that we see you if you have any questions or concerns for your child.